Hello, my name is Crystal Puentes, and this week's Ethics Corner is for us to discuss what our thoughts are on emerging evidence base to support the argument that clinical leaders can improve healthcare outcomes. And reflecting on our own experiences, is clinical leadership always a good thing? So, I'll start off by just kind of using an example from my job. I do believe that leadership has a pretty significant impact on the way things are run. You know, we are so busy as nurses on the floor. We have so many things to worry about that we commonly kind of just are doing tasks in a way and kind of need reminders on, important things. The leaders can see statistically what we need to work on. They're the ones that know we're not going to be aware of that. We're going to keep working, taking care of our responsibilities. But at the end of the day, mistakes are made. Things could be done better. And leaders can see that and they know, what we could possibly do to fix it. So what our leaders at my job, I work with Memorial Hermann, and our location specifically has the highest scanning rate for medications. So since I had started there, they had been pushing this, scan our meds, reminding us oftenly to all the ER staff that, this to them was extremely important. And over the time, we have still remained, out of all the locations, the highest percentage of medications being scanned along with the patient being scanned. So what that has done is actually also placed us as the safest place to be medicated in the Memorial Hermann system because of scanning our medications. That is one of the biggest things that was created for the safety of patients, because there are a lot of medication errors that were occurring because we're just in such a rush. We're giving so many meds. And that was the whole purpose. So you would give it to the right person. It would be the right dosage. It would be the right medication. It would be the right time. And it would also even flag you if there's any contraindications. So that's because they worked so hard in it. I do believe that it did impact even me thinking about it sometimes. Like, yes, I love it. I love the way it kind of protects you and the patient. But I do remember, hey, I'm in such a hurry. Let me just click this off. I forgot to scan it. But in reality, they just kept pushing it in our heads. And I was like, no, let me go back and scan this. So I definitely do think it did have an impact. And the result of it did improve healthcare outcomes for the patients. I did find an article as well on the effects of transformational leaderships, which I will put the reference in the little text box at the bottom of this video. So they did some research at the Institute of Medicine, and one was done in 2004, a little old, in 2010, but it did say that researchers have linked patient safety outcomes of the quality of nursing work environments, lack of effective leaderships. In the organizational literature, relational leadership styles have been linked to reduce adverse patient outcomes. Now, this whole article, which was published in 2018, goes over an extensive amount of instances and kind of goes more into depth on how the leadership kind of also provides job satisfaction on top of patient safety outcomes. So I will put it in there so you guys can take a look at it. But it's also kind of stating the same thing that I kind of gave an example of, is pretty much they're the ones that are pushing you. They're that reminder that you know, there are ways to do things better. And, you know, we're just so stuck in our ways that sometimes we just need a little bit of directing and also discovering things that we're doing wrong, you know, bringing some light to it. I do believe that a poor leader, someone who's not very, you know, involved in wanting to make changes, does have an impact as well, because I feel like, you know, if they're not pushing you and you're not really, you know, you just feel like we're just doing our jobs, we're just taking care of the patients, we already have enough on our plate, you know, who's actually going to be doing it? Who's actually going to be telling us, like, hey, like, this year, this many falls happened, or, you know, things like that. Like, we're not the ones that actually look at those things. So I do believe that, you know, without a good leader, things like that could happen. I mean, if people are calling in and no one's, you know, telling them anything, and, you know, everyone's like, okay, well, who cares? I'm gonna call in, and, like, they're gonna fire me. What that creates is additional short staff, which means that the patient care goes down, the quality of it, because we're short staffed, and now people are waiting longer in the waiting rooms already. It's already probably like an 8-hour wait. Now they're waiting longer because we're short staffed. You know, people who need rooms can't get them because we're just taking forever just to, you know, clear the rooms that we already have. It's a lot of aspects. You know, the leaders are so busy, but they actually kind of monitor a lot of aspects of what we do and almost like see the bigger picture. So I do believe that they have a huge effect on it, and I've been fortunate enough to work under, for the most part, for my nursing career, I've had plenty of really great clinical leaders. I believe I've never had any issues with them. I feel like they definitely made the job more bearable, because we all know nursing has been rough because of COVID. But I definitely believe that, you know, they made me feel supported. They were hearing me out. They were trying to work with me on any concerns that I had. And for me, I believe that really went a long ways. And I think that's about it. So thank you for listening.